Muscles are also sensitive to injury, nerve fears traction, sensitive to stretch, blood vessels fear of handling. They are sensitive to crushing. Example, while suturing the muscle, you align the muscle fibers longitudinally, not transversely. You avoid tight knots. So why? Because anatomy tells you how tissue heals. A surgeon respects what he understands. Anatomy teaches you where not to cut. Good surgeons are known not by how much tissue they cut, but by how much tissue they save. Example, during the carpal tunnel block, you inject at one precise point. If anatomy is wrong, animal still feel pain and if the block fails. So correct anatomy is painless surgery. So doctor will not go ahead if the carpal tunnel block fails. So that surgeon then decide where to cut and where to not cut. Anatomy tells predictive thinking. A surgeon must predict what will happen if this structure is cut, what deficit will appear if it is damaged. Example, radial nerve injury that indicates dropped elbow, that also indicates inability to extend limb. Anatomy allows prediction before injury occurs. Anatomy train minimalism in surgery. Good surgeon remove only what is necessary. Example, preserving blood supply during tumor removal ensure healing. Anatomy teaches conservation in this regard. Anatomy trains or teaches safe speed of the operations. Speed without anatomy is danger. Anatomy gives confidence and controlled speed. Example, during cesarean section, you know the muscle layers which are displayed from skin up to the uterus. You know the uterus position. You know the placenta. After palpating uterus, gravid uterus. So you should know the placenta and that must be avoided. So your hand moves faster because your brain is clear. Is it nerve injury? Is it fracture? Is it joint disease? Example, if it is a dropped elbow, so that indicates radial nerve injury. If it is abnormal mobility of the animal, that indicates fractures. If it is a pain and swelling around the articulation, it indicates a joint disease. So that diagnosis begins with anatomical thinking. Anatomy trains decision hierarchy. Anatomy helps to decide to operate or not, to incise or to observe, to repair or to excise. Example, incomplete nerve injury that usually we use conservative management. If there is complete rupture of the nerve, surgical repair is possible. Structure guide the treatment choice. So this indicates the structure guide the treatment choice. Anatomy trains directional thinking. Structure are arranged in specific direction. Muscle fibers, facial planes, neurovascular bundles. So there are hundreds of the muscles inside the body, and then you have to cut to reach up to the inner structure of the body. And the direction of muscle fiber is very important to consider while healing of the wound or proper suturing and proper healing of the wound. Again, facial planes are there, running in different directions that you have to consider during surgery. Neurovascular bundles, the bundles of blood vessels, nerve. So they are also there, they should be protected like that. So example, muscles are split along the fibers, not across them, to reduce bleeding and improve healing. Direction is an anatomical lesson. Importance of muscle fiber direction. What does muscle fiber direction means? A muscle fibers are arranged in specific anatomical direction designed for contraction, strength, and blood supply distribution. Surgery must respect this natural arrangement. If any surgeon or any clinician do not respect this natural arrangement, anatomical arrangement, then the healing of the wound will not be proper. Incision along the muscle fiber, if it is given, there will be less damage. Why? Fiber separate easily, minimal bleeding, less muscle necrosis. For example, in flank surgery, external obliquus abdominis. Fibers run backward and downward. Internal obliquus abdominis, fiber run forward and upward. Incising along these fibers allow muscle to part naturally. Anatomy train ethical surgical thinking. Respect for anatomy teaches humility, patience, and responsibility. The surgeon learns, I am working on life, not on the tissue or dead tissue. A good line for surgeon. A scalpel in an untrained mind is dangerous. A scalpel in an untrained mind is dangerous. Anatomy trains the mind before it trains the hand. Thank you. The topic the topic is open for discussion if you want to ask on this.
No questions.
Thank you, sir, for sharing your views nicely on structure to solution and insight into applied anatomy, and beautifully highlighting how anatomy forms the foundation of diagnosis, surgery, and ethical decision making. Thank you, sir. Now I request Dr. Ashutosh Samwal to speak about the topic applied anatomy of head and neck region.
Good morning. Morning, respected principal sir, head sir, faculty members, and my dear interviewees. Myself, Dr. Ashutosh Singhal, Assistant Professor, Department of Veterinary Anatomy, and today I am going to address on the topic for the workshop on applied anatomy of head and neck. Am I audible, everyone?
Yes, sir.
So, this is my content for the topic. Nerve block, we are going to see nerve block first, then palpation sites, CS, collection sites, paracentric systems, and surgical sites. First we have to start with nerve block. So, as you all know, nerve block are very important for to administer the various anesthetic techniques. And in head region, there are various nerve block we perform in the field. So, in head region, I will start with corner nerve block. So, corner block. Uh, so, if we have to perform any nerve block, we have to see its anatomy. So, convolular nerve is essentially nerve, and it supplies its own core and skin around its base. It is a branch of zygomatical temporal nerve, which is a division of the ophthalmic branch of trigeminal nerve. And the site of the nerve block is close to frontal crest of the frontal bone, about 1 inch below the base of the horn. So it is close to the frontal crest. If you have studied in the skull, the frontal crest is present on the frontal bone. Okay, and indications. The clinical sequence it is performed for the amputation of horn in certain conditions. Okay, for example, horn cancer and fracture of horn. So you can appreciate this image. You can see the site of the convolular nerve block. Okay, where I am pointing. This is the needle, and this is the convolular nerve. You can see, and this is the crest of the frontal nerve bone. And in this side, we will inject the anesthetic agent. Okay, and you can see the adjacent structures. So if we have to perform any surgical procedure or nerve block, we have to also see the adjacent structures, that is surrounding structures. Okay. Next is the mandibular nerve block. So the mandibular nerve is a branch of trigeminal nerve, and it enters the mandibular foramen on the medial aspect of vertical ramus of the mandible, and emerges through mental foramen on the lateral aspect of the mandible. Okay, so this nerve that is mandible nerve. If you see anatomy, so it enters the mandible foramen on the medial aspect of the vertical ramus. Okay, if you remember mandible, it has horizontal ramus and vertical ramus. So it has the vertical ramus has medial aspect and lateral aspect. So in medial aspect, the mandible nerve emerges through mental foramen. Mental foramen also present there. Okay, so this is the anatomy of the mandible nerve, and the site. If you see the site of this nerve block at the mandible foramen on the medial aspect of the vertical ramus of mandible, that is mandible foramen, which is present on the medial side. Okay, medial surface of the vertical ramus. Indication at the mandibular foramen. Uh, this is not an indication by mistake. So, in case of medical foramen, this is used to perform in various conditions to desensitize that area of the mandible. Okay, so you can appreciate this image of the mandible. So this is actually mandible of sheep. So you can see the vertical ramus and horizontal ramus. Okay, this is horizontal and this is vertical ramus. And on vertical ramus, you can see the appearance of mandibular foramen. And on this mandibular foramen, we will inject the anesthetic agent. Next, mental nerve block. Mental nerve block. The mandible nerve gains exit at the mental foramen on the lateral aspect of the horizontal ramus of mandible near the body. Okay. So in this case, the mandible nerve, we can see we will desensitize the mandible nerve, and if you can see the course of this nerve, it gains exit at the mental foramen. Okay, so we have to keep in mind the location of the mental foramen, and it is the mental foramen is present on the lateral aspect of the horizontal ramus of the mandible. Okay, in the previous nerve block, we have seen the which foramen?
Mandible foramen.
Okay, and in this case, we will see the
Mental.
mental foramen. Okay, if you see the side at the mental foramen on the lateral aspect of horizontal ramus of the mandible near body. Okay, so side of the nerve block is mental foramen. So this is the mental foramen. Okay, which side is this? Which aspect?
Left.
Okay, so this is the horizontal ramus and lateral side, lateral aspect, and where mental foramen is present. And on this foramen, we will inject that anesthetic agent. Okay. So if you see the clinical significance, it is used to perform desensitize the lower limb. Then next nerve block is maxillary nerve block. And if you see anatomy, the maxillary nerve, which is a branch of triangular nerve, and it emerges through the foramen orbitorotatum. Okay, so this is a very important foramen orbitorotatum, which then it passes through the pterygopalatine fossa, which we are which thing we are talking about. We are talking about the maxillary nerve. Okay, so we are seeing its course. So the maxillary nerve passes forward in the pterygopalatine fossa and enters. Then it enters into the infraorbital canal through maxillary foramen. Okay, so this is the anatomy and the course of that maxillary nerve. Okay, then at the site of this nerve block, the maxillary foramen to be reached by inoculation needle through the site to 2-3 centimeter below the external canthus of the eye and between the posterior border of the malar bone and coronate process of mandible. So if you remember, eyes has got inner canthus and outer canthus. Okay, so the maxillary foramen is reached through this inoculation needle and 2 to 3 centimeter below the external canthus of the eye. Okay, and in between the posterior border of malar bone and coronate process of mandible. So you also remember the coronate process. Okay, you remember all coronate process. Okay, so this is the maxillary nerve. Maxillary nerve. This is, you can see the maxillary yellow color. Okay, and number one is that the maxillary foramen. Okay, you can see this is the course of that maxillary nerve. Okay, then next is the infraorbital nerve, and in this case, infraorbital nerve is the continuation of maxillary nerve, and it emerges out through infraorbital foramen. Okay, so this nerve, infraorbital nerve, is a continuation of maxillary nerve. Okay, the previous nerve, and it emerges through infraorbital foramen. So, infraorbital foramen is present where? It is present on the skull. Okay, so the side is the infraorbital foramen is reached to the level of upper third cheek tooth in horse and upper first cheek tooth in ox. So, in both the species. In case of the ox, it is present, the infraorbital foramen is present at the upper first cheek tooth in case of ox, and in case of horse, it is present at the level of upper third cheek tooth. Okay. Indication: surgical interference with the upper lip and nostrils. Okay. So this is the infraorbital nerve block. Okay. This is the site of the infraorbital nerve block. Okay, and that is where the this is present at the level of upper third
First.
Okay, so it is present at the level of upper first cheek. Okay, that is where the infraorbital foramen is present. Then supraorbital or frontal nerve block. Supraorbital nerve is one of the terminal branches of the ophthalmic division of the fifth cranial nerve, and it accompanies the supraorbital artery and is sensory to the upper eyelid. Okay. The site of this nerve block is at the root of the supraorbital process, and the indications are to desensitize the upper eyelid. Okay. So supraorbital process, if you can see here, supraorbital process, this is the supraorbital process where I am pointing out. Okay, clear? Then orbital nerve block and its anatomy, ophthalmic and maxillary branches of trigeminal nerve, which are sensory in nature and emerges out from the cranium through foramen orbitorotatum. The ophthalmic nerve supplies branches to the eyeball, proper eyelids, conjunctiva, lacrimal sac, and third eyelid, while zygomatic branch of the maxillary nerve supply to the skin of lower eyelid. So you can see the supply of the ophthalmic nerve. It is supplying to eyeball, okay, conjunctiva, lacrimal sac, third eyelid, and a zygomatic branch. So maxillary nerve has got two branches. Okay, side. So if you see the side of this nerve block, foramen orbitotendon through behind the middle of the supraorbital process in the temporal fossa. Okay. So where is the orbital nerve block is performed at the side, where is the side foramen orbitotendon through behind the middle of the supraorbital process in the temporal fossa. Okay. If you see the clinical significance, it is done to eviscerate the eye wall, orbital abscesses, malignant disease of eye. Then last is the auricopalpebral nerve block, and if you see its anatomy, auricopalpebral nerve supplies to the orbicocularis oculi muscle. Okay, and it is one of the branches of facial nerve and motor to eyelids and auricular to ear muscle. Okay, site at the level of zygomatic arch. Okay, where zygomatic arch is present, zygomatic arch is present near the zygomatic process. Okay, and where in the zygomatic arch, zygomatic muscle is also present. Okay, then if you see its clinical significance, surgical affections related to eyelids. So this is all about the nerve blocks. Okay, so this is the last nerve block, auricopalpebral nerve block. Okay, you can see the location of the nerve block, the side of nerve block. Okay, so they are the auricularis, which surround the eye. Okay, then the palpation sites. So we all know already palpation is used to perform to detect any disease conditions. Okay, in the field. So if we will start with the palpebral bone. Okay, so in animal body there are some palpebral bone which is helpful to address any disease conditions. In head region, frontal crest, facial tuberosity, zygomatic arch, rim of orbit, nasal bone, body of frontal bone, angle of mandible bone, horizontal ramus of mandible bone. Okay, these are the palpebral bones. Okay, through these palpebral bones we can address any disease conditions. Okay, so first is the frontal crest, and first frontal crest is a sharp longitudinal ridge of the frontal bone extending from the base of the horn toward the orbit. Okay, so on the frontal bone, the crest is what's the appearance of frontal crest? It is a sharp longitudinal ridge of the frontal bone which extends from the base of the horn toward the eye orbit. Okay. Next, where is the location of this frontal crest? It is present also the aspect of the skull, and it is situated between the eye and the horn. Okay. Clinical conditions. So it is the clinical sequence of the frontal crest is it is the primary landmark of the coronal nerve, which we have seen recently. Okay, in the previous slide. Next is the facial tuberosity. Facial tuberosity is a prominent thrust bony projection on the lateral surface of the maxilla. Okay, so since it is a tuberosity, so what's the appearance of the tuberosity? Tuberosity appears like a projection. Okay, and that projection is present on the lateral surface of the maxilla. Location on the side of the face, approximately 3 to 4 centimeter towards the third upper rim. Okay, so the location of that tuberosity is very important. Then the clinical indication. It is used to locate an intra-orbital foramen which lies just closer to it. Okay, and palpating this site is essential for performing infra-orbital nerve blocks to desensitize the upper lip and nose for minor surgeries. So these two structures we have seen, facial tuberosity and frontal crest. These two bony palpebral structures are helpful for nerve blocks. Okay, nerve block. Then the rim of the orbit. If you see its anatomy, it is the bony circle surrounding the eye and location surrounding and extending behind the eye. Okay, rim is just like is a circular structure. Okay, you have all seen in general like we are carrying across through the term rim. So that rim is present around the eye only. Okay, clinical indication palpated to assess the fractures of cancer eye. That is ocular squamous cell carcinoma. Okay, so cancer eye also known as ocular cancer squamous cell carcinoma. You all know better. You have studied all about this cancer and various medical conditions. Okay. Then nasal bone. If you see its anatomy, it is a paired flat bone forming the dorsal roof of the nasal cavity. Okay. And its location, the bridge of the nose, it is present at the base of the nose, extends from the forehead to the nose. So it extends from the forehead where the frontal bone is present. Okay, until the muzzle. Okay, muzzle portion. Then the clinical indication, it is palpated for symmetry and pitting. Okay, so pitting is actually a softness. So where there is any softness or symmetry is disturbed, so we can say get the idea that is any disease condition is present. Okay, and in young calves, softening can indicate metabolic bone diseases. While in adults, deviation suggests chronic nasal granulomas or tumors. Okay, so granulomas like condition or tumors like condition, they are present in that location, nasal bones. Okay, body of frontal bone. So body of frontal bone is a large, flat, expansive bone that forms the entire forehead and houses the massive frontal sinuses. Okay. Then location. This is the topmost place of the head between the two horns. So frontal bone is present in between the two eyes and two horns. Okay. Clinical condition. This is the primary site for percussion. So percussion is a procedure, okay, used to address any disease condition. Okay. And a dull sound when tapping here indicates frontal sinusitis, a common application where pus fills the sinus after deworming. So, body of the frontal bone is useful to address these conditions, frontal sinusitis. Then, horizontal ramus of mandible. What is the horizontal ramus of mandible? We have seen in the previous slide. I have shown. It is a long, thick, tooth-bearing body of the lower jaw. Okay. Then clinical indication, the hallmark site for diagnostic gum piece of it. That is also known as actinomycosis. Okay. So actinomycosis is a which condition? This type of condition. Bacterial.
Bacteria.
It is a hard, immobile, bony swelling. Here is a classical sign of this chronic bacterial infection. So the horizontal ramus get hard and the swelling gets get appear in this case. Okay, horizontal ramus of mandible. Then the angle of mandible. It is a curved posterior inferior corner where the horizontal meets the vertical ramus. So horizontal line and vertical line where the both line meets, there the angle forms. So this is a mathematical term. So if you see it anatomically, this is the curved posterior inferior corner where the horizontal ramus and vertical ramus. Okay, they meet. Location: the very back corner of the lower jaw near the throat. And if you see its clinical significance, used to assess the mandibular lymph node located just medially and to identify the path of facial artery for pulsing. Okay. Next, so we have seen the palpebral bones, bony structures. Now, palpebral lymph node. In neck region, prescapular lymph node. This is very important lymph node. So this is a palpebral lymph node. It lies on the cranial border of the supraspinatus muscle, just dorsal to the shoulder joint. Okay. So it lies just dorsally shoulder joint, and it is buried underneath the omotransversalis and brachiocephalic muscles. Okay, so it is present underneath these two muscles. But in most cattle, it is fed through the skin. Okay, so in case of the cattle, it is easily fed in the skin. Okay, if you see its clinical significance, so in case of bovine tuberculosis and zoonotic bovine necrosis, in these two conditions, the pre-scapular lymph node get enlarged or swelled. Then in the head region, mandibular lymph node, also known as submaxillary, it is situated in the intermandibular space between the sternoclephalicus muscle and ventral part of the mandibular salivary gland. So it is situated in between the intermandibular space. Okay, so where the intermandibular space present, where in the backward side of the mandible, where the vertical ramus is present. Okay, that is the intermandibular space. So in that space, there is a presence of sternoclephalicus muscle and the ventral part of the mandibular salivary gland, and it is near to the angle of the jaw. Okay. Significance actinomycosis, so also known as lumpy jaw, actinomycosis. Okay, this is a bacterial disease again, wooden tongue, or stomatitis form infections. So in these conditions, the mandibular lymph node gets swelled or inflamed. Then the parotid lymph node, it is also present in the head region. So it is found on the posterior border of the masseter muscle, partly covered by the dorsal end of the parotid salivary gland, and just below, in front of the ear. Clinical significance: cancer eye, also known as ocular squamous cell carcinoma. Okay, so you can appreciate this image. You can see the lymph nodes that is present on in the whole body. In the whole body, you can see the lymph nodes, but for the moment, you can concentrate on the lymph node which are present on the head region. So that is parotid lymph node, mandibular lymph node, and in the neck region, pre-scapular lymph node. I have just taught this. Okay, these are all the other lymph nodes which are present on the other regions of the body. Okay. Then the palpebral arteries. So in the field, when we go to the field, so to examine the animal, we need to palpate the different arteries. Okay. So in cattle, facial artery in the head region. So facial artery is along ventral anterior border of the masseter muscle with vein and extensor duct behind, pressing against the ventral border of the congenital ramus of the body. So this is the location and the position of the facial artery. So in case of cattle, facial artery is used to palpation to address any disease condition. Okay. Then the horse, in case of horse, external maxillary artery. So this can be felt on the medial surface of the vertical ramus of the mandible. So different species, different arteries. Then palpebral veins. So there are two veins which are palpable, easily palpable. That is jugular vein and ear vein. Okay. So in these two veins, we generally perform venipuncture, like to administer any drug or to collect the blood. Okay. So jugular vein is located in the jugular furrow. That is, upward boundary is formed by lower part of tracheoesophagus. Lower boundary is formed by sternomandibularis, and medial boundary is formed by sternomastoides. Okay, so these all muscles makes the boundary of this jugular furrow. Okay, then the ear veins are found on the convex outer surface, that is surface of the ear. Okay, the location of the ear vein is at the outer surface of the ear. So that is very common vein, ear vein and jugular vein. Then the CSF collection sites. So until now we have studied the palpating sites and nerve blocks. So now CSF collection site, that is cerebrospinal fluid. So atlanto-occipital site. What's the location? The atlanto-occipital space located on the dorsal midline between the occiput, that is the back of the skull, and the atlas, that is the first cervical vertebra. Okay, so location of this Atlanta hospital site is Atlanta hospital case. Okay, two bones are involved, that is atlas and scapula. Okay, indications meningitis or encephalitis. Example, listeriosis in cattle, brain tumors or abscesses. So in these conditions, the CSF is collected to examine. Okay, so you can appreciate this image. Is it visible to everyone? So
Yes,
you
sir.
can see the this is the skull bone. Okay, where I am pointing, this is the skull bone and this is the vertebral column. This is the first cervical vertebrae. Okay, first cervical vertebrae. This is the uh, cranial surface. This is the caudal end. So cranial and caudal end. On so where is the CSF collection site? So I mentioned at the Atlanta hospital case. So you can see the Atlanta hospital case. So these are the projections. You can see this is so these are the Atlanta hospital case, which is present in between the hospital bone and the atlas bone. So this space is creating that is known as Atlanta hospital case. Okay, that is where the needle is inserted. Okay, then paracentesis sites. So paracentesis is used to generally perform the aspiration for aspiration. So first is the ocular paracentesis, okay, which is present on the head region. So location, the needle enters the anterior chamber of the eye. Okay, usually at the limbus, that is the junction of the clear cornea and the white sclera. So limbus is a junction of the clear cornea and the white sclera. Okay, you can see the limbus portion. Okay, clear cornea and white sclera you can see here. Okay, indications: collecting fluid for cytology or culture in severe eye infection, reducing intraocular pressure in acute glaucoma, or removing intraocular parasites. Okay, that is Ceteria infections. Okay, that is the parasitological disease in case of the horse, which is caused by Ceteria. Okay, so this parasite is helpful in these conditions. Now the lastly the surgical sites. So common surgeries which are performed in the head and neck regions. So that is the dehorning for removing the horn, and that is also known as amputation. So where we perform the coronal nerve block. To perform amputation, firstly we have to perform the coronal nerve block to desensitize that area. Okay. Site is the converse process of the frontal nerve. And if you see the landmark, so landmark, what is landmark? Landmark is the adjacent surrounding structures. Okay, so that is the frontal crest, which is permitted to administer a nerve block to the conval nerve before the horn is removed at its base. Then, uh, sinus surgery, also known as trephination. So, site is frontal sinus, which is present in the forehead, or maxillary sinus, which is present on cheek area, and the landmark is point midway between the medial canthus of the eye and the horn base for frontal bone, or dorsal to the facial tuberosity for maxillary bone. Indication: treatment for corneal sinusitis, removal of sinus cyst, or precaution of infected tooth rot in roots in horses. So in these conditions, trepanization is performed. Okay, so side is frontal sinus or maxillary sinus, which is very important. Next is the mandibular symphysiotomy or bone plating. Side is horizontal ramus of the mandible. Landmark is the ventral border of the lower jaw. Indication: repair for the repair of mandibular fractures common in trauma or lumpy jaw trauma. That is tracheotomy, tracheotomy, laryngeotomy. Okay, so tracheotomy, the ventral line, the sides and ventral midline of the neck, usually between the upper and middle third of the cervical tract. Landmark is tracheal veins are calculated through the skin border to the larynx, and the clinical significance is upper airway obstruction, laryngeal edema, or cough leakage. So side is ventral midline of the neck, and it is usually present between upper and middle third of the cervical vertebra. Episiotomy, side is the left jugular throat. Landmark, the esophagus lies slightly to the left of the trachea in the mid-neck region. Clinical significance for the removal of any foreign body. Sometimes the foreign objects get stuck in the neck area, especially in the esophagus. And in case of choke, that can only be resolved by the stomach. Lastly, laryngotomy. The site is the ventral midline over the larynx. Landmark cricoid-thyroid membrane, that is the spot present between the thyroid and cricoid cartilages. These are the cartilages present in the larynx. So, landmark is cricoid-thyroid membrane. Indication treatment for the laryngeal hemiplegia or root. Okay. There are also many conditions which are present, present on the head and neck region, and various surgeries, other surgeries also are performed. But I address the common surgeries which you perform in the field condition. Thank you.
The topic is open for discussion. If anybody wants to ask any question on the thorax and neck region, head and neck region, please ask.
It will be more effective if we show some diagram. That will be more effective. Just site. Yeah, surgical site. I mentioned that will be more
Surgical sites, they are not decided.
Good prediction.
Yeah.
Thank you, Dr. Samal, for wonderfully explaining different nerve blocks and other structures of head and neck region, and the way to put it to practical use of the therapy. Thank you. Now I request Dr. Deepa Kaur to say about the like anatomy of thorax and abdominal region.
Thank you, Dr. Mishra. Meetings of the day are respected Head of Department Dr. A. Patil, Head of Department LPM, and my dear fellow colleagues and family and colleagues. So the topic of discussion today will be the applied anatomical sites located in the thorax and abdominal region. So the sites that we'll be discussing will be related to the auscultation, percussion, biopsy sites, various sites for paracentesis, CSF collection sites, surgical sites, as well as common nerve blocks. So as you all know, auscultation and percussion are procedures which are used to assess the internal organs and body cavities. So auscultation is basically the procedure which pertains to listening to the internal sounds of body cavities and especially hollow organs with the assistance of an instrument called a stethoscope to assess their condition. So the common organs which are assessed are lungs, intestines, heart to listen to the murmur sounds or autonomic sounds which are found in the abdominal cavity, especially stomach and intestines. Likewise, percussion is tapping the body surfaces with the help of your hands assisted with a small instrument to assess if there is presence of any fluid or air in those concerned or targeted organs. So the commonly formed site in case of box are between third and fifth intercostal spaces, likewise in case of small animals, like in case of canines or dogs. The most common site for auscultation and percussion procedure is between 4 to 6 rib or the fifth intercostal space. Now, biopsy is a specialized procedure which pertains to removal of any tissue from intact animal or a live animal for diagnostic purposes like histopathology. Now, after the collection of a specimen, which can be a mass from a growth which has been persistent for quite some time and which has not gone into the state of dissolution due to medication, so you can go for sampling of that specimen and go for fixation of the tissue, followed by processing of the tissue, which includes changes of alcohol, acetone, xylene and benzene procedure, and then you go for staining of that particular tissue after preparation of slide, which involves an important step, that is microtome sectioning. Then the last step involved is staining of that concerned slide. Now various type of stains are used. The basic and routinely used stain is histological stain, which is H&E stain, hematoxylin eosin stain. Apart from that, various other stains are also available, specialized stain like immunohistochemical staining, in which you prepare antibody titers and you detect the presence of antigen for detection of various diseases. Also, you can go for Hofbradley stain for detection of elastic fibers, for the intensity of collagen fibers. So, for the detection of mast cell tumor, you can go for tolerant blue stain, etc. So, biopsy has various indications. So, the masses which does not respond to medication, a persistent tumor which you are suspecting it to be neoplastic, you can go for that. Any inflammatory changes which has been present for quite some time, you can go for biopsy of that. So, and also you can assess the diagnosis for those conditions which you are unable to identify otherwise by radiography or by clinical findings. Now, various types of biopsy procedures are needle biopsy, which involves the use of a small needle in which you can aspirate out the cellular contents. Bone marrow biopsy, it is used to detect conditions like leukemia and other brain conditions like lymphoma, in which you aspirate out the bone marrow from various sites like ventral part of sternum, iliac crest, proximal part of humerus, which is mostly used in dogs, etc. Aspiration is also called as fine needle aspiration cytology or fine needle aspiration biopsy, in which you aspirate out the mass or contents from that mass, and it is also assisted by ultrasonography so that you can reach out to the targeted organ. Then surgical biopsy involves laparoscopy as well as laparotomy procedure. So in this photograph, various instruments have been enlisted which are used for biopsy procedures, like for puncture biopsy punch is used to pinch out the sample. In this guided fine needle aspiration biopsy, you can take the help of ultrasound so that you can reach the targeted organ and aspirate out its contents. And this, the iliac crest is being approached in order to extract out the bone marrow to study conditions like leukemia, lymphoma, etc. So, liver biopsy can be performed in certain conditions. For example, hepatomegaly, which is a normal lesion size of the liver, which is obviously visible on ultrasound or radiographic findings, and if there has been consistent increase or persistent increase in the liver enzymes like ALT, AST, etc., and if you find out solitary or multiple lesions within the parenchyma of the hepatic tissue, you can go for liver biopsy, and the preferred site for that is 10th or 11th intercostal space. So this slide shows us how we can take out a sample from the liver by the use of instrument, and we can assist it with the help of ultrasound so that we are reaching to the particular organ precisely. So laparotomy is is a more invasive procedure in which involves incision of the abdominal wall, especially it is performed in small animals and those organs which are deeply seated which cannot be assessed otherwise. So it involves incision, suturing back the incision site later on. But there are certain complications like it can lead to sepsis later on that can be medically managed. Other complications that can arise after biopsy procedure, particularly which are very invasive, are peritonitis, hemorrhage, sepsis, and those animals which have coagulopathies, like there is abnormality in the presence of clotting factors, they are more prone to complications, and those who have less amount of or less count of platelets, that is thrombocytopenia, which can lead to excessive hemorrhagic conditions, they are more prone to complications. Other sites for biopsy are gallbladder biopsy. So gallbladder anatomically situated on the visceral part of or visceral surface of the liver, and it projects beyond the right border of the liver. So the preferred site would be 11th intercostal space. For biopsy cecal, you can reach out to the pelvic inlet region, which is guarded by the wings of the ilium bone, which is a primary bone of the os coccyx. For spleen biopsy, again 12th intercostal space is the preferred site. Spleen is located just under the rib cage on the dorsal part of the abdominal cavity. Regarding the kidney biopsy, you have to reach for rectally and pierce the wall of the rectum, and left kidney is the most preferred among the two for getting specimen of the kidney. For non-biopsy, trocar and cannula type of specialized instrument is used, which is introduced at the level of 8th or 9th intercostal space. Now, paracentesis again is a procedure in which there is involvement of collecting body fluids. So this procedure is also called as peritoniosynthesis, especially when we collect fluid or ascitic fluid which is present in the peritoneal cavity. So the preferred site for in case of heart puncture, it is 4th intercostal space in case of large animal, and ruminants, cattle and sheep in case of equines, canines, and felines it is between 4th and 5th or 4th to 5th intercostal space. Small animal thoracentesis, which again involves collection of fluid either from the pleural cavity or the thorax. It is 7th and 8th intercostal space, and if you are suspicious of presence of fluid within the thorax and the pleural space, you can insert the needle 2/3 of the chest cavity. If there is suspicion of presence of air in human thorax, you can insert the needle 1/3 of the way of down the chest cavity, and in order to restrain the animal, because it is practically a painful procedure, you can lightly sedation, or you can just give a local anesthetic agent to the animal just for tranquilization purpose. In case of equines, thoracentesis can be performed on both right and left side with a slight difference in the side. So on the left side, if you're approaching the left side, you can go for 7th or 8th intercostal space. If you're approaching the right side, you can go for 6th to 7th intercostal space. And local anesthetic agent is administered just into the subcutaneous tissue involving intercostal musculature and parietal part of the pleura. However, a stab incision is necessary while doing the thoracentesis. So in this picture, we can see how equine thoracentesis is being performed, and you can drain out the fluid. So certain conditions can be there if there is accumulation of excessive fluid, like ascites is there, or if you are collecting the fluid from the pleural space for diagnostic purpose, you can go for thoracentesis procedure. So this procedure is being done in a small animal, in canine. In cattle, thoracentesis, make sure that animal is standing. This will give you a clear picture of the thoracentesis region or the targeted site. Then you can puncture it with the needle and tunnelize it under the skin. So certain complications can however arise. A rapid drop in blood pressure, that is hypotension, if there is a leakage of the fluid, It can lead to hemorrhage if you have accidentally punctured vital vein, as well as it can lead to sepsis or infection. So that is why debridement, scrubbing is of vital importance while preparing for the site. The common site for bone marrow collection are iliac crest. Almost in all the species it is preferred. Then ventral part of the sternum is almost preferred site in all the species. However, if we go species wise, in case of ox, the dorsal end of 8 and 11 tube are very approachable. You can go for that. Ventral sternum, iliac crest as well. In case of horse, again ventral sternum, iliac crest being the common site, and spinal processes of first lumbar vertebra. This is common site for collection of the bone marrow. In case of sheep and goat, ventral part of the sternum and iliac crest again. In case of dog, apart from trochanteric fossa and iliac crest, you can go for proximal part of the humerus as well. In case of pig, apart from sternum, proximal tibia, femur and iliac crest, humerus, head can be approached for collection of bone marrow. So in case of dog, apart from those sites, this proximal part of humerus is very approachable, so you can go for the collection of bone marrow from this site as well. In case of goat and sheep, iliac crest is very approachable site because the bony prominence is very much visible and can easily assess this site under light sedation. Iliac crest is again preferred site in case of pig as well. However, for CSF collection, in order to figure out the presence of meningitis, listeria-like condition or encephalitis, you can go for collection of CSF from the lumbosacral region in the abdominal part. Apart from this, other preferred sites are atlanto-occipital joint in the head and neck region. Now, nephrotomy is a very common procedure. So this term has been derived from Greek word lepra, which means soft part of body, which is located between the rib region and the flank region. And tomy means to cut surgically or to make a surgical cut. So in this, the incision is made through abdominal wall. In case of large fluence, it is done through mid-flank vertical incision. So this is how animal is prepared, and then the surgical site is closed properly, the suture. In case of canines, ventral abdominal incision is preferred, which is directed along the linea alba, because linea alba is the site with minimal blood supply and minimal nerve innervation, so it leads to less hemorrhagic shock during the course of surgery. So this is the preferred site in case of small animals, the ventral abdominal incision, which is directed along the linea alba. Various indications for doing abdominal surgeries or nephrotomy in case of canines are ovarian cyst, endometriosis. Any exploratory nephrotomy can be done to figure out the reason for abdominal pain in order to assess adrenal tumors, reasons for female infertility, or ovarian torsion, which is twisting of ovaries on their own axis. So abdominal paracentesis again is the simply collection of the fluid from the abdominal cavity. If it pertains to collection of fluid from the humor, it is called as luminal paracentesis in case of large animals. Diagnostic paracentesis can be done to just collect a sample of the fluid for diagnostic purpose, and therapeutic can be done to relieve the animal from pain if there is excessive accumulation of fluid within the body cavity. So because excessive accumulation of fluid can lead to increased intra-abdominal pressure further will have its effect on breathing pattern of the animal. It can lead to dyspnea, etc. In order to relieve the animal from such conditions, you need to relieve the animal by clearing out the fluid from the cavity. Again, certain risks are associated. It can lead to leakage of cyclic fluid into adjacent cavity, which is healthy. It can lead to sepsis, hemorrhage, and bowel perforation accidentally. Mortality, however, has been documented in such cases, but it is very rare. In case of ruminants, left epigastric region, and the ventral part of the abdomen is the preferred site. So epigastric region is the very initial part of the abdominal region. So abdominal region has been divided into 9 smaller regions just for the convenience sake with the help of 2 sagittal and 2 transverse plane which you study in the very first year. So epigastric, mesogastric and hypogastric are 3 major regions, on the lateral side of which again are 2 sub-regions. So epigastric region is the preferred site for the collection of the fluid. In non-ruminants, however, the 12 intercostal space near the thoracic region is the preferred site. So human paracentesis you can perform by approaching the left paralumbar fossa. Why left paralumbar fossa? Because anatomically humor is situated on left half of the median plane, and again the boundaries of left paralumbar fossa are, if you remember from your anatomy lessons, the cranially is guarded by the ribs, dorsally is guarded by or covered by the lumbar vertebra, and ventrally and caudally it is being covered by abdominal muscles like external abdominal oblique, internal abdominal oblique, and ventrally rectus abdominis. So all these are the boundaries of paralumbar fossa, and it is very much visible when the animal is hungry. So it looks like a proper triangular depression. You can directly reach out into the luminal cavity by puncturing this triangular paralumbar fossa. Splenectomy again, removal of partially diseased or for diagnostic purpose. So anatomically it is situated just under the rib cage, just caudal to the rib cage. Various indications can be if there is hemangiosarcoma, if you're suspicious of a tumor-like conditions, if there is thalassemia-like condition, coagulopathy is associated with the spleen, or if there is abscess, then you can do the diseased part of the spleen. The site in case of large animal can be left paralumbar fossa, and again in small animals, canine calamities, directed along the liamba by giving ventral abdominal incision. So in case of small animals, this is the location of spleen, and this is how we can do splenectomy after the whole procedure has been done. So cystotomy is incising the wall of urinary bladder. In case of various indications, for example, if there is presence of stones which are urinary calculi, or there is, you have to repair the injury which has occurred in case of urinary bladder, or if there is presence of any tumor, you can go for cystotomy. So this is the whole surgical procedure which involves incision, figuring out the area, and then proper closure of the wall. And during closure, make sure the sutures are watertight, because any micturition pressure, it can open the sutures and lead to delayed healing. So a urinary bladder would typically heal within a time period of 3 weeks. So ventral midline cystotomy is the more preferred site, although dorsal and ventral can be approached, but ventral midline incision would heal rapidly. So catheterization is the insertion of catheter through the urethra, which is directed towards urinary bladder in order to drain out the bladder. So the indications can be urinary incontinence, which is dribbling or leakage of the urine, and urinary retention, which is the condition in which animal is unable to evacuate the bladder on its own. So in order to prevent that condition or evacuate the bladder, you can go for catheterization. So this picture depicts how you can assess the urinary bladder by inserting the catheter through the urethra. Then certain other sites are cesarean section and enterotomy. So in cesarean section, a paramedian incision is given, which is just parallel to the subcutaneous abdominal vein or the mammary vein. Indications can be difficult birth, which is called as dystocia, or uterine torsion, when the uterus twists on its own axis. You can relieve the animal from that condition if you are unable to do it, otherwise fail by other techniques, and failure of cervical dilation in case of parturition. Enterotomy is the surgical incision which involves open of the intestine in conditions like interception, what relates, you can go for introductory procedure. So in this, the incision has to be made at the anti-mesenteric border, just proximal to the concerned obstruction, or when there is a need to remove any fecalic or interactive matter from the intestines. The paravertebral block involves desensitizing the spinal nerves which are the last thoracic, first, second, spinal nerves. So you can desensitize these nerves for various procedures, surgical procedures. So it involves two categories, proximal and distal. In case of proximal, you are just reaching clearly to the transverse process of the concerned lumbar vertebra. In case of, however, distal, again same T13, L1 and L2 are involved, but you reach the distal end of the lumbar transverse vertebra. Thank you.
Any question on abdomen and thorax? Some question?